So what I'm going to do now is draw on her the outline of the areas where we're going to do these procedures, and you'll understand how we make our plans to do the rejuvenation. All right? So first we're going to focus on the Botox, and the lines that people get, the falling that people get is because the muscles are too strong and the skin's not as strong as it used to be. So we want to kind of weaken those muscles in a selective way to help some of these lines go away. So what I usually ask patients to do is to frown for me, frown down like you're angry. There you go. And we'll mark where those muscles start. Okay, now relax. And now I know exactly where to inject the Botox, so that's going to help these lines that form in the center here. Then I'll ask the patient to lift her eyebrows for me, and now we can see where those muscles are and treat them so they won't form those lines anymore. Okay, now relax. Good. All right. And we'll also have the patient smile for me. And now I can treat these little smile lines, or crow's feet, as we call them, on the outside of her eyes. Okay, so that's where we're going to do Botox. Now, in the cheeks, there's two issues going on. She's losing a little bit of fat in this area, and she's lost definition of her cheekbones as well. So we want to put a little volume there to kind of lift upward. And we also want to put a little volume here to kind of fill in this area where things are a little deficient. So I'm just going to draw where we want to fill. Adriana, did you have a white pencil? And then we're going to put a little bit on the cheekbones itself, because what that does is it actually gives a lift, and you can see how if I can lift this up and hold it there, things look better. So we do that through 3 little injections here, and the same thing here, 3 little injections, and that'll give us a little lift there. Then where we really see it in Mary is kind of in this, what we call the perioral area around the mouth. And she's losing fat in this whole area. So we want to add a little filler here, and a little bit in this area, and a little filler there, and again down in this area. We want to get rid of this indentation that she has and make that jawline smoother, camouflage the jowl by filling in where she's losing fat in that area. And then finally, we have the platysma muscle, which you can see on either side. Luma is we lift and then we inject all the way down to the bone. And these little tent poles help hold the tissue upward. So lift again, go down to the bone, we create a little tent pole, and it helps hold that tissue upward. And one last one, down to the bone, and then back, all right? So we accomplish 2 things. One, we're creating a little nice fullness of the arch, and then we're also holding that tissue upward. You can see with the camera now how she's got this nice curve to her cheek, whereas if you look from this side, she's a little flat through there. So we finished the procedure. Just want to show you again what we did. We used Botox to smooth the forehead, to lift the eyebrows, to treat the lines between the eyes, to treat the lines out here. We used Voluma to help widen the face where we need to have a little bit more cheekbone projection, and also to give her a little bit more volume there. We use Juvederm to fill both in this area and down below. And where you really see this Juvederm is along her jawline, where she was really indented before. And now her jawline is smooth, and you can see how it's camouflaged the jowl, because before you could see this big prominence and then an indentation, and now her jawline looks smooth right across there. And because it looks smooth, the focus of the bottom of her face is her chin. All right, so we've gone from a square-looking, more oval-shaped face to that inverted triangle of youth. So we've given her, your focus is here, so your eye goes from here down to there in an inverted triangle. It's very rejuvenating. And finally, we did Botox down here in the neck, which is going to give her some help with these bands. And hopefully in a couple of weeks, we'll see these much less prominent. Okay. She was a fantastic patient. Did it hurt?
Not at all.
I mean,
Not one
you saw
bit.
how many times I stuck her, and she didn't flinch
Nope.
once. She was amazing, a great patient, and I'm sure she's going to get a fantastic result once everything's kicked in. So this was our first transformation patient. I hope to do another one for the next month, and we'll start another contest again and see if we can select someone else. I hope it's you.